Dear learners, we are here with another topic of CVS pharmacology, that is antihypertensive agents. We have studied about the adrenergic blockers and we studied about the mechanism of action of adrenergic blockers. At the same lecture, we have studied that there are basically two types of adrenergic blockers. They are alpha adrenergic blockers and beta adrenergic blockers. Today in this lecture, we will study the pharmacology of beta adrenergic blockers, that is their mechanism of action, therapeutic usage, adverse effect, pharmacokinetics of these type of drugs. We have already studied that basically these are beta blockers are the first line therapy for hypertension. Why first line therapy? Because it is well established in hypertensive patients as compared with their adverse effect and efficacy of this drugs in case of particularly hypertension. Here, so it is first line drug therapy for hypertension, and when there is a concomitant condition, comorbid condition with other disease like CHF, angina, etc. When these drugs are combined with hypertension, then we can easily use these type of drugs or beta adrenergic blockers. So in case of, if we see here the mechanism of action that exhaustively we have studied in previous lectures or the first part of this adrenergic blocker, that basically these are the antagonists of beta receptors. Beta receptors, which beta receptor? Beta 1 and beta 2 receptors. These are basically the antagonists of beta receptors. That means these can block the beta adrenergic receptors. We have already studied that these can basically block the beta receptors. If beta adrenergic blockers goes to the beta receptors, it does not allow to enter the adrenaline or noradrenaline, and so that the next intracellular physiological functions will be inhibited. So it can be used as an antihypertensive agent. Other aspects of these drugs, beta receptors, may basically decrease the cardiac output, and we have studied that BP equals to cardiac output into peripheral resistance. If cardiac output will decrease, then automatically BP will be decreased. So basically beta adrenergic blockers decreases the cardiac output. How? Because the beta receptors present on beta 1 receptors present on heart will be blocked, and so that the contraction of heart will be inhibited, so that the cardiac output will be decreased, and so that ultimately the BP will be decreased. Another mechanism of action of beta adrenergic receptors, beta adrenergic blockers may be, it may decrease the sympathetic outflow from CNS, like central sympatholytic agents. Central sympatholytic agents basically they decrease the outflow from CNS or from brain stem, and ultimately the noradrenaline release or adrenergic release will be inhibited. So in some context it may decrease the sympathetic outflow. Another aspects or another mechanism may it inhibit the renin from kidney. And what happen after renin? If there is no renin, angiotensin second will be decreased, and ultimately what happen? Aldosterone will be decreased, and if aldosterone will be decreased, then what happen? It decreases basically the BP. So these all are the basic three mechanism of action of beta adrenergic blockers. Now examples of beta blockers we have already studied: propranolol, metoprolol, atenolol, etc. Prototype drug is propranolol. Basically we have studied that these are non-selective beta blockers. That means it may blocks beta 1 receptors, or it may also blocks the beta 2 receptors. But some like atenolol, metoprolol, these are the selective beta 1 receptor blockers. So we are here with the therapeutic uses of beta adrenergic blockers. Basically these are used in hypertensive patients, but which type of patients? Generally these are used in young patients as compared to elderly people. Why? In case of elderly people, there are more chances of CHF, obstructive lung disease. So we generally do not use these drugs in case of elderly people. We generally use it in case of young people. So these are the subsets of hypertensive population use of these beta adrenergic blockers. Next one that is important, that hypertensive patients with concomitant disease, that we have already studied that these are basically used in patients with have comorbid conditions like previous MI, myocardial infarction, angina, migraine, headache, and congestive heart failure. If these type of comorbid conditions are exist, then we can easily treat the patients with beta adrenergic blockers like propranolol. Next one is pharmacokinetic of beta adrenergic blockers. These are orally active and these have extensively high first pass metabolism, high and also variable first pass metabolism, and also it makes several weeks for its full extensive effect. That means its the excretion rate is slow and it is not greatly metabolized from the body, so may take several weeks for full effect. Now come to the adverse effect of beta blockers. There are basically three category of, we can divide in three category the adverse effect of beta adrenergic blockers. Some are common adverse effect like bradycardia, decrease in heart rate, hypotension. Obviously if we use beta blocker in higher quantity, then what will happen? The beta blood pressure will be decreased and hypotension will increase. Some CNS effects are there like insomnia and also fatigueness, letharginess, etc. Sexual dysfunction. Now come to the disturbed lipid metabolism. It is an important adverse effect, that is it may decrease the HDL, high density lipids, and increase plasma triacyl glycerides composition. And there is an most important adverse effect of beta adrenergic drugs are drug withdrawal. Drug withdrawal, what happens when we suddenly discontinue the drug therapy of beta adrenergic blockers? Then what will happen? There may be chances of myocardial infarction, angina, or sudden death. So we cannot suddenly discontinue these beta blockers like propranolol, metoprolol, atenolol, etc. We can discontinue in phase-wise manner. That firstly we have to reduce. Suppose we are taking 10 mg, then we have to take 5 mg, and so that we have to decrease in phase-like manner the dose of beta adrenergic blockers. These are the basic mechanism of action, adverse effect, therapeutic uses, and pharmacokinetics of beta adrenergic blockers. Thank you.